Hey, future RNs. Welcome to our 4,500 NCLEX questions series. Today, we're covering the board's top questions, repeated over 5 times in 5 years, shared by students who passed NCLEX and are now RNs. Stick around for the 30-33 rule. Watch 30 videos 3 times, and you'll pass NCLEX in 30 days. Let's start today's test. Let's move to the first question. This Enoxaparin-related question has been asked 6 times in the last 5 years, making it important to know for the exam. The nurse is tasked with administering Enoxaparin to a patient receiving anticoagulant therapy. Which laboratory value should the nurse prioritize for regular monitoring during the administration of Enoxaparin? A. Platelet count. B. Activated clotting time. C. Prothrombin time. D. Hemoglobin levels. Correct answer. A. Platelet count. A is correct. Enoxaparin is classified as a low molecular weight heparin, primarily used for its anticoagulant properties to prevent and treat blood clots, especially in high-risk patients, such as those undergoing surgery or immobile due to illness. A significant potential complication of low molecular weight heparin is heparin-induced thrombocytopenia, which is a dangerous immune-mediated response that results in a sharp drop, over 50%, in platelet count, while paradoxically increasing the risk of clot formation. To mitigate this risk, monitoring the patient's platelet count is crucial after starting Enoxaparin therapy. If there's a marked decrease in platelets, the nurse must notify the healthcare provider immediately, as this could signify heparin-induced thrombocytopenia, requiring discontinuation of Enoxaparin and possible initiation of alternative treatments. B is incorrect. The activated clotting time is not typically used in monitoring low molecular weight heparin therapy. It is more commonly associated with procedures involving high-dose unfractionated heparin, such as during cardiopulmonary bypass surgery. Enoxaparin does not require continuous monitoring of clotting times, as its anticoagulant effect is more predictable and does not necessitate dose adjustments based on activated clotting time. C is incorrect. Prothrombin time and its derivative, international normalized ratio, are used to assess the efficacy of warfarin, a different type of anticoagulant. These tests are not applicable to Enoxaparin, as it acts on a different part of the clotting cascade, specifically inhibiting factor Xa and factor IIa. Therefore, prothrombin time, or international normalized ratio monitoring, is unnecessary for patients on Enoxaparin. D is incorrect. While hemoglobin levels are important to monitor in situations where there may be bleeding or anemia, they are not specifically affected by Enoxaparin itself. Hemoglobin monitoring would be relevant if there is suspicion of internal bleeding, which could be a complication of any anticoagulation therapy. However, platelet count monitoring takes precedence when evaluating for complications directly linked to Enoxaparin, particularly heparin-induced thrombocytopenia. The NCLEX is tough, but only serious students make it through. Watch this video to the end if you're truly dedicated to becoming a nurse. Let's move on to the next question. This Nortriptyline overdose-related question has been asked 7 times in the last 5 years, making it highly probable for the exam. A patient arrives at the emergency department following an intentional overdose of Nortriptyline, a tricyclic antidepressant. What is the most critical piece of information the nurse must gather? A. The exact quantity of tablets ingested. B. The medical condition for which the drug was prescribed. C. History of prior suicide attempts and the methods used. D. Events and emotional triggers leading to the overdose. Correct answer. A. The exact quantity of tablets ingested. A is correct. Nortriptyline, classified as a tricyclic antidepressant, poses a high risk of fatality when taken in excessive amounts due to its cardiotoxic effects, including arrhythmias and prolonged QT intervals. Knowing the precise number of tablets consumed is crucial to determining the potential severity of the overdose. This data will assist healthcare providers in estimating the risk of life-threatening complications and guide the immediate treatment plan, which should include obtaining a 12-lead electrocardiogram and initiating continuous cardiac monitoring to detect early signs of arrhythmias or other cardiac complications. Tricyclic antidepressant overdoses can rapidly deteriorate into critical conditions, making prompt cardiac assessment essential. B, C, and D are incorrect. While understanding the reason the patient was prescribed nortriptyline, option B, their history of previous suicide attempts and methods, option C, and the emotional or situational triggers for the overdose, option D, are important for long-term mental health evaluation and safety planning. They are not immediately relevant to the acute management of the overdose. Immediate clinical interventions, such as stabilizing cardiac function and preventing complications, take precedence. The patient's survival and immediate well-being depend primarily on identifying the extent of the overdose and initiating appropriate medical treatment, such as the administration of activated charcoal or sodium bicarbonate, if indicated. Therefore, determining the number of pills consumed is the most vital information in the acute care setting. Let's move to the next question. This liver biopsy positioning question has been asked 5 times in the last 5 years. The nurse is preparing a patient for a liver biopsy, ensuring that the patient is positioned correctly for optimal access to the liver and patient safety. Which of the following is the most suitable position for the patient to be placed in for the procedure? A. Lying face down with arms stretched out above the head. B. Lying flat on the back with the right arm extended away from the body and head turned to the left. C. Lying on the left side with the right arm raised above the head. D. Positioned with the feet elevated higher than the head, in an inverted position. Correct answer, B. Lying flat on the back with the right arm extended away from the body and head turned to the left. B is correct. The supine position with the right arm extended away from the body and the head turned to the left is the optimal positioning for a liver biopsy. This allows for clear access to the liver beneath the right rib cage, enabling the healthcare provider to perform the biopsy accurately. The right arm is abducted to ensure that the rib cage is fully accessible without any obstruction. Turning the head to the left is also crucial as it helps maintain a clear airway, ensuring the patient's breathing is unobstructed during the procedure. This positioning also provides stability to the patient during the biopsy. A is incorrect. A prone position, where the patient lies face down with arms stretched overhead, does not facilitate adequate access to the liver. The liver is positioned on the right side of the body under the ribs, and this positioning makes it difficult for the healthcare provider to perform the biopsy due to poor visibility and access to the target site. C is incorrect. While placing the patient on their left side may expose the right side of the body, raising the right arm above the head is not ideal for comfort or effective access to the liver. The arm could create unnecessary tension in the muscles around the biopsy site and may interfere with the precision needed for the procedure. D is incorrect. The Trendelenburg position, where the patient's legs are elevated and their head is lowered, is primarily used for managing conditions such as hypotension or certain surgeries involving the pelvis or lower extremities. It offers no advantage for accessing the liver and may even pose risks by elevating intra-abdominal pressure, making it harder to safely reach the liver for a biopsy. Let's proceed to the next question. This question about cast complications has been asked 9 times in the last 5 years, making it highly important. A nurse is monitoring a patient who had a fiberglass cast applied to their lower right leg earlier in the day. During a routine check, which patient statement should prompt the nurse to take immediate action? A. I've noticed a deep, aching sensation in my calf over the past few hours. B. My leg is so itchy inside this cast, it's driving me crazy. C. I've been keeping my leg flat on the bed most of the time without elevating it. D. When I use my crutches, I rely on my arms and hands to hold myself up. Correct answer, A. I've noticed a deep, aching sensation in my calf over the past few hours. A is correct. A sudden onset of pain, particularly in the calf, could signal a complication like compartment syndrome, a condition that occurs when pressure within the muscles builds to dangerous levels, reducing blood flow, which can result in tissue damage. The cast could be compressing the underlying tissues, nerves, and blood vessels, limiting circulation. This type of pain, especially if it's unrelieved by elevation or pain medications, requires urgent intervention. Immediate removal of the cast or further diagnostic testing may be necessary to prevent permanent damage. Patients with new casts should be informed about the importance of reporting symptoms like increasing pain, numbness, or tingling, as these can indicate potentially severe complications. B is incorrect. While itching is a common and frustrating side effect for patients with a cast, it is not typically dangerous. Itching often occurs as the skin becomes dry or irritated inside the cast, especially in warmer environments where sweat and heat can accumulate. The nurse can recommend safe strategies like using a cool hairdryer to blow air into the cast, but this is not an urgent concern. Patients should be cautioned against inserting objects into the cast to scratch, as this can lead to skin injuries or infections. C is incorrect. Although failing to elevate the leg, especially in the first 24 to 48 hours after injury or casting, can slow the reduction of swelling, it does not present an immediate risk that requires urgent intervention. Elevating the leg above the level of the heart helps to minimize swelling and pain by improving venous return, but not doing so will typically cause discomfort rather than serious complications. The nurse should remind the patient of the benefits of elevation, but need not treat this as an emergency. D is incorrect. It is proper technique for the hands and arms to support the body's weight when using crutches. Patients must be instructed to avoid putting weight on the underarms, as this can compress nerves and lead to a condition called crutch palsy. The use of arms and hands to bear weight is appropriate and not a reason for concern. Let's move to the next question. This physical assessment question has been asked 6 times in the last 5 years and is highly likely to appear in the exam due to its frequent repetition. A healthcare professional is performing a physical examination using percussion techniques. In which of the following areas is a tympanic sound most likely to be detected? A. Upper extremities. B. Abdominal region. C. Lower extremities. D. Chest cavity. The correct answer is B. Abdominal region. B is correct. Tympany is the sound typically heard when percussing over the abdomen, particularly over areas filled with gas, such as the stomach or intestines. Percussion is a technique used in physical assessment where the practitioner taps on the body to evaluate underlying structures. The sounds produced provide insight into the density of the tissues underneath. For instance, when percussing over the abdomen, a tympanic sound is often heard due to the presence of air within the gastrointestinal tract. This high-pitched, drum-like sound indicates a hollow space beneath the surface and is normal during routine physical exams, especially over the stomach and bowel. A, C, and D are incorrect. Tympanic sounds are not expected in the upper or lower extremities, as these areas contain primarily muscle, bone, and soft tissue, which do not produce such resonant tones. Additionally, while percussion over the chest or thorax can yield resonant or hyperresonant sounds due to the air-filled lungs, timpani is specific to the abdomen and is not normally heard in the thorax, unless there is an abnormality like a pneumothorax, air in the pleural space. Therefore, timpani is most appropriately heard during percussion of the abdomen. Let's move on to the next question. This dietary recommendation for infants has been asked 5 times in the last 5 years, making it a commonly repeated topic in exams. A nurse is providing dietary advice to the parent of a 7-month-old baby regarding which new foods can safely be added to the child's diet. Which of the following would be the most suitable option for the nurse to recommend? A. Whole cow's milk. B. Diluted fruit juice. C. Plant-based yogurt without added sugars. D. Sweetened electrolyte beverages. The correct answer is C. Plant-based yogurt without added sugars. C is correct. Plant-based yogurt, such as soy yogurt, without added sugars, is a safe and nutritious option for a 7-month-old infant. It provides essential proteins and fats without the potential complications that dairy might cause at this age. Soy-based products are often easier to digest and do not pose the risk of milk allergies or lactose intolerance. Moreover, introducing a variety of flavors and textures at this stage supports sensory development, and plant-based yogurts can be a good source of calcium and vitamins when fortified. A is incorrect. Introducing whole cow's milk before the infant is 12 months old is not recommended due to its high levels of protein, sodium, and potassium, which are difficult for immature kidneys to process. Additionally, cow's milk lacks vital nutrients, such as iron and certain fats, that are crucial for brain development during the first year of life. Early exposure to cow's milk also increases the risk of iron deficiency anemia, since it can interfere with the absorption of dietary iron. B is incorrect. Although diluted fruit juices may seem harmless, they are not advisable for infants due to their high natural sugar content, even when diluted. These sugars can contribute to tooth decay and excessive calorie intake without providing the necessary nutrition for a growing child. Moreover, fruit juices can lead to digestive issues, such as diarrhea, and are not recommended by pediatric experts for children under the age of 1 year. Whole fruits or pureed fruits are much better alternatives. D is incorrect. Sweetened electrolyte beverages, like flavored sports drinks, are not suitable for infants. These beverages contain high amounts of added sugars and unnecessary electrolytes, which can cause imbalances in a young child's system. Additionally, the high sugar content can promote unhealthy eating habits and increase the risk of obesity later in life. Infants at this stage should be primarily consuming breast milk or formula with appropriate solid food introductions, and water can be introduced in small amounts after 6 months. Before moving to the next question, we have some exciting news. We are offering a comprehensive NCLEX crash course, and you can compare in this table what we offer versus what our competitors provide. Don't forget to enroll in our new batch, which started on October 5th. Classes are conducted live every day for 1 hour, continuing for 3 months. However, you'll also get access for 1 year. You'll receive 10,000 previously asked questions and 50 practice tests. But don't delay. Our 70% off discount is about to end soon. Visit our website to enroll. The link is in the description box. Let's continue with the next question. This preterm labor medication question has been asked 7 times in the last 5 years and is highly relevant for exam preparation. A nurse is providing care for a pregnant client who is at 30 weeks gestation and experiencing signs of potential preterm labor. The healthcare provider is considering medications to delay delivery and manage the condition. Which of the following medications is the nurse most likely to prepare for administration? Options: A. Amoxicillin. B. Nifedipine. C. Pitocin. D. Misoprostol. The correct answer is B. Nifedipine. B is correct. Nifedipine is a calcium channel blocker commonly used as a tocolytic, which helps in preventing or delaying premature labor by relaxing the smooth muscles of the uterus, thus reducing the intensity and frequency of contractions. By inhibiting calcium influx into muscle cells, nifedipine effectively prevents preterm uterine contractions, making it a critical intervention for managing preterm labor. The drug is generally well tolerated, although close monitoring of blood pressure is required due to its systemic vasodilatory effects. A is incorrect. Amoxicillin is an antibiotic used for treating bacterial infections, and it plays no role in delaying preterm labor. It may be indicated if the client has an infection, such as group B streptococcus, but it is not directly associated with controlling uterine contractions. C is incorrect. Pitocin is a synthetic form of oxytocin and is used to induce or augment labor by stimulating uterine contractions. In the case of preterm labor, the goal is to stop or slow down the contractions, so Pitocin would be contraindicated, as it would exacerbate the situation rather than alleviate it. D is incorrect. Misoprostol is a prostaglandin analog that promotes uterine contractions and is often used for cervical ripening, labor induction, or to manage postpartum hemorrhage. In the context of preterm labor, misoprostol would not be suitable, as it would increase uterine activity and hasten labor rather than preventing it. Let's move on to the next question. This infection control protocol question has been asked 4 times in the last 5 years and is critical for ensuring safety in healthcare settings. A nurse is caring for a pediatric patient recently diagnosed with measles, rubiola. What type of infection control protocol should the nurse prioritize to prevent the spread of the virus within the healthcare setting? A. Implement contact-based isolation precautions. B. Utilize droplet precautions for infection control. C. Employ airborne isolation measures. D. No specific isolation precautions are required. The correct answer is C. Employ airborne isolation measures. C is correct. In managing a patient diagnosed with rubiola, commonly referred to as measles, airborne precautions are critical because this virus is highly contagious and can spread via tiny airborne particles. The virus is known to remain suspended in the air for extended periods, posing a significant risk of transmission to others who may be in the same environment. To prevent this, the patient should be placed in a room with negative pressure airflow, which ensures that contaminated air does not circulate into other areas of the hospital. Additionally, healthcare professionals should wear an N95 respirator or equivalent protective gear when entering the room to avoid inhaling airborne particles. The room should also remain closed at all times to prevent the spread of the virus into the hallway or adjacent areas. It is essential for healthcare staff to follow strict protocols, as measles can be transmitted even several hours after an infected person has left the area. A is incorrect. Contact isolation precautions are used for infections that are transmitted through direct physical contact with the infected person or their immediate surroundings, such as infections caused by Clostridium difficile or methicillin-resistant Staphylococcus aureus. These diseases involve direct touch as the primary transmission route and are not airborne like rubiola. B is incorrect. Droplet precautions are necessary for illnesses where the infectious particles are larger than 5 microns and typically transmitted by coughing, sneezing, or talking. This type of precaution would be appropriate for illnesses like influenza, pertussis, or rubella. but is insufficient for rubeola as it requires stricter airborne precautions to prevent smaller particles from spreading in the air. D is incorrect. It would be highly unsafe to omit isolation measures for a patient with rubeola, given the highly infectious nature of the disease. Without proper precautions, the virus can spread rapidly, especially in environments where individuals with weakened immune systems may be present. Immediate isolation with airborne precautions is mandatory in such cases to prevent outbreaks. Your success on the NCLEX depends on how much effort you're willing to put in. If you're serious, you'll stay until the very last second of this video. Let's continue with the next question. This religious preference question, related to blood transfusions, has been asked 9 times in the last 5 years, making it highly likely to appear in the exam. A nurse is developing a care plan for a patient who identifies as a Jehovah's Witness and is scheduled for major surgery. The patient has expressed concerns about the potential need for blood transfusions during the procedure. After reviewing the patient's religious preferences and consulting with the surgical team, what should the nurse document regarding the patient's care preferences? A. The patient consents to receiving blood transfusions only if a life-threatening emergency arises during surgery. B. The patient agrees to alternative therapies, such as medications, but refuses blood transfusions based on religious beliefs. C. The patient rejects all forms of medical intervention, including surgery, due to their religious beliefs. D. The patient strictly declines any transfusion of whole blood, even in emergency situations, in line with religious practices. The correct answer is D. The patient strictly declines any transfusion of whole blood, even in emergency situations, in line with religious practices. D is correct. Jehovah's Witnesses generally adhere to a belief system that prohibits the transfusion of whole blood or certain blood components, such as red blood cells, plasma, and platelets. However, many Jehovah's Witnesses may accept alternative treatments or procedures that do not involve these restricted blood products. Therefore, it is important for the nurse to document that the patient refuses whole blood transfusions, even in critical situations. Alternative treatments like cell salvage or non-blood volume expanders may still be considered acceptable, and these preferences should be clarified in the patient's chart. A is incorrect. Jehovah's Witnesses typically do not consent to blood transfusions, even in life-threatening scenarios. This stems from their religious interpretation of Scripture, which views the consumption or use of blood as a violation of their faith, regardless of medical necessity. B is incorrect. Although Jehovah's Witnesses generally accept most medications and treatments that do not involve blood products, this option is misleading because it suggests that the patient might accept blood transfusions in an emergency. The key distinction for Jehovah's Witnesses is their refusal of whole blood and certain blood products, not medications. C is incorrect. Jehovah's Witnesses are permitted to undergo surgery and other medical interventions, provided that their beliefs about blood products are respected. They do not categorically reject medical care, but rather require that treatments be compatible with their religious guidelines. Let's move to the next question. This obstetric emergency question has been asked 8 times in the last 5 years and is crucial for understanding how to manage cord prolapse during labor. The nurse is assisting a patient in active labor when an umbilical cord prolapse is identified. Which of the following interventions should the nurse prioritize to prevent complications? A. Advise the patient to bear down during the next contraction to expedite delivery. B. Initiate oxygen therapy at 2 liters per minute via nasal cannula to maintain oxygenation. C. Immediately place the patient in a knee-chest position or Trendelenburg to relieve pressure on the cord. D. Request an order for oxytocin to intensify uterine contractions and hasten delivery. The correct answer is C. Immediately place the patient in a knee-chest position or Trendelenburg to relieve pressure on the cord. C is correct. A prolapsed umbilical cord is an obstetric emergency that places the fetus at significant risk for hypoxia due to cord compression. The nurse's primary goal is to alleviate pressure on the umbilical cord to restore blood flow to the fetus. Positioning the patient in the knee chest or Trendelenburg position immediately helps elevate the fetal presenting part away from the pelvis, reducing compression on the cord and improving oxygen delivery to the fetus. Alternatively, the left lateral Sims position with elevated hips can also be effective in relieving cord compression. Each of these positions elevates the maternal hips higher than the head, promoting the movement of the fetus away from the pelvic opening. A is incorrect. Encouraging the patient to push during contractions would exacerbate the problem. Pushing increases the risk of further compressing the umbilical cord, cutting off vital oxygen and nutrient flow to the fetus. In cases of umbilical cord prolapse, labor progression should be halted until emergency interventions, such as a cesarean section, can be performed to ensure fetal safety. B is incorrect. Although oxygen administration is important in maternal care, 2 liters per minute via nasal cannula is not an appropriate intervention in this case. In scenarios involving umbilical cord prolapse and potential fetal distress, the recommended oxygen delivery method is via a face mask at 8 to 10 liters per minute to maximize oxygen supply to both the mother and fetus. Nasal cannula oxygenation at such a low rate would not sufficiently address the urgent oxygen needs. D is incorrect. Administering or requesting oxytocin is contraindicated in cases of prolapsed cord. Oxytocin induces uterine contractions, which can increase pressure on the cord, worsening fetal hypoxia. The goal in this emergency is to relieve pressure on the umbilical cord, not to stimulate further labor activity, which could aggravate the situation. Instead, preparation for an emergency cesarean section is the appropriate course of action. Let's move on to the next question. This placental complication question has been asked 7 times in the last 5 years and is important for managing obstetric emergencies. A pregnant client, currently at 35 weeks gestation, arrives at the emergency department reporting severe, painful vaginal bleeding. The nurse should prioritize assessing for which of the following complications? A. Placental abruption. B. Placenta previa. C. Preterm rupture of membranes. D. Expulsion of the mucus plug. The correct answer is A. Placental abruption. A is correct. The nurse should immediately suspect placental abruption, also known as abruptio placentae. In this situation, as the client's symptoms, significant pain and heavy vaginal bleeding are classic indicators of this life-threatening condition. Placental abruption occurs when the placenta prematurely detaches from the uterine wall, often leading to complications such as maternal hemorrhage, hypovolemic shock, disseminated intravascular coagulation, and even maternal or fetal death if untreated. For the fetus, the abrupt separation can cause oxygen deprivation, blood loss, premature birth, or stillbirth. Immediate medical intervention is crucial to stabilize both the mother and the fetus. B is incorrect. Placenta previa involves the placenta being located abnormally low in the uterus, often covering the cervix. This condition typically causes painless vaginal bleeding, contrasting with the client's report of painful bleeding, making placenta previa an unlikely diagnosis in this case. Placenta previa can pose risks such as hemorrhage during delivery, but does not usually present with the level of pain described here. C is incorrect. Preterm rupture of membranes, PROM, refers to the rupture of the amniotic sac before labor begins, generally presenting as a sudden gush or persistent leakage of clear amniotic fluid, not blood. While PROM can lead to infection or preterm labor, the symptoms do not match the client's complaints of painful and heavy bleeding. D is incorrect. The passage of the mucus plug, which blocks the cervical canal during pregnancy, is typically a minor event and often goes unnoticed by the woman. When observed, the mucus plug is more commonly seen as a small amount of discharge, possibly streaked with blood, but it does not cause the kind of heavy bleeding or intense pain the client is experiencing. Exciting news before the next question. We're offering an exclusive NCLEX crash course, and you can see for yourself how we stand out compared to our competitors in the table below. Our new batch started on October 5th with daily live classes for 1 hour over 3 months. Plus, you get access for a full year. With 10,000 real NCLEX questions and 50 practice tests, you'll be fully prepared. Don't miss out on the 70% discount. It's ending soon. Visit our website to grab your spot. The link is in the description. Let's proceed with the next question. This psychiatric medication question has been asked 6 times in the last 5 years and is essential for patient education on anxiety management. A nurse is providing education to a client who has just been prescribed buspirone for managing generalized anxiety disorder. Which of the following statements made by the client would indicate the need for additional clarification by the nurse? A. I understand that it might take several weeks before I start feeling the full effects of this medication. B. It's important for me to take this medicine regularly, either with food or without, but I should stick to one method. C. I plan to use this medication only during times when my anxiety gets really severe. D. I might feel some nausea while taking this, but that should improve over time. The correct answer is C. I plan to use this medication only during times when my anxiety gets really severe. C is correct. The client's belief that buspirone can be taken only during intense episodes of anxiety is incorrect. Unlike fast-acting anti-anxiety medications such as benzodiazepines, buspirone is a maintenance drug that must be taken consistently on a daily basis to be effective. It works gradually by modulating serotonin and other neurotransmitters, and it does not provide immediate relief. If a client waits until anxiety peaks to take the medication, it will not be effective in managing symptoms. A is incorrect. This statement reflects accurate understanding. Buspirone typically takes anywhere from 2 to 4 weeks to show therapeutic effects. It does not act like benzodiazepines, which produce almost immediate symptom relief. Therefore, patients should be prepared for a gradual improvement in their anxiety levels rather than an immediate response. B is incorrect. This is correct information, as buspirone can be taken either with or without food. However, it's essential to maintain consistency in how it's taken, always with food or always without, because this consistency helps ensure proper absorption and reduces the likelihood of fluctuating blood levels of the drug. D is incorrect. Nausea is a common side effect of buspirone due to its action on serotonin receptors. It is similar to the side effects experienced with other medications that affect serotonin levels, such as selective serotonin reuptake inhibitors. The side effects are usually mild and tend to resolve over time as the body adjusts to the medication. This thoracentesis positioning question has been asked 6 times in the last 5 years, making it highly likely to appear in your exam. While preparing a patient for a thoracentesis procedure, the nurse should position the patient in which of the following ways to ensure the best access for needle insertion and optimal patient comfort. A. Sitting upright, leaning forward with arms resting on a bedside table and feet supported by the floor or a stool. B. Positioned on the unaffected side, with the head of the bed completely flat. C. Prone, with arms fully extended overhead. D. Lying on the affected side with the head of the bed raised at a 45-degree angle. The correct answer is A. Sitting upright, leaning forward with arms resting on a bedside table and feet supported by the floor or a stool. A is correct. For thoracentesis, the ideal positioning is for the patient to be seated upright, with arms and head supported on a stable surface, such as a bedside table. The patient's feet should be flat on the floor or supported by a footstool. This posture helps spread the rib spaces and provides easy access to the pleural cavity via the posterior intercostal spaces. Thoracentesis is most commonly performed to drain excess pleural fluid in conditions like pleural effusion or pneumothorax, and this position minimizes the risk of complications by allowing gravity to pool the fluid in a single location for easier removal. B is incorrect. While a lateral recumbent position with the head of the bed flat may be considered for patients who are unable to sit upright, it is not the preferred position. In this alternate method, the patient is positioned lying on their unaffected side, and this method is generally used only in specific cases, such as when the patient is on mechanical ventilation or physically unable to sit up. This position makes fluid drainage slightly more difficult compared to the upright position. C is incorrect. The prone position, where the patient lies face down with arms extended above the head, is typically reserved for surgeries involving the spine or posterior body, not for thoracentesis. This position would make access to the pleural space nearly impossible and increase the risk of injury during needle insertion. D is incorrect. Lying on the affected side during thoracentesis is counterproductive, as it would compress the area where the procedure needs to be performed. The alternative position of lying on the unaffected side is acceptable in certain cases, but the patient should never be positioned on the side requiring treatment, as this limits access and could exacerbate the condition being treated. Real commitment means not stopping halfway. If you're determined to pass the NCLEX, don't quit. Watch this video until the end. Let's continue with the next question. This bisphosphonate contraindication question has been asked 5 times in the last 5 years, making it important to understand potential complications. A nurse has been given a prescription to administer an oral bisphosphonate to a client diagnosed with osteoporosis. Upon reviewing the client's medical history, which of the following conditions would be a reason to withhold the bisphosphonate and consider alternative treatment options? A. History of diabetes mellitus. B. Elevated calcium levels in the blood. C. Intolerance to dairy products. D. Previous Roux-en-Y gastric bypass surgery. The correct answer is D. Previous Roux-en-Y gastric bypass surgery. D is correct. A client who has undergone a Roux-en-Y gastric bypass is at an increased risk of complications from oral bisphosphonate use. This type of bariatric surgery alters the digestive system in a way that increases the likelihood of esophageal irritation or ulceration, particularly due to the potential for reflux and altered gastric emptying. Bisphosphonates are known for causing esophagitis and even esophageal ulceration, especially if not taken correctly, i.e., with adequate water and while sitting upright. In patients with this type of surgery, the altered anatomy makes these complications more likely, which contraindicates the use of oral bisphosphonates. A is incorrect. Diabetes mellitus, though a risk factor for developing osteoporosis, does not contraindicate the use of bisphosphonates. Clients with diabetes may benefit from bisphosphonate therapy as part of their osteoporosis management. However, close monitoring for side effects and complications is necessary due to the overall health of the client. B is incorrect. Hypercalcemia, or high calcium levels, is not a contraindication for bisphosphonate use. In fact, bisphosphonates are sometimes used to lower calcium levels in conditions like malignancy-associated hypercalcemia, as they work to increase bone mineral density by slowing down bone resorption. C is incorrect. Lactose intolerance itself does not interfere with the administration of bisphosphonates. While lactose intolerance may affect calcium intake if the client avoids dairy, it does not directly impact the use of bisphosphonates. Clients with lactose intolerance can still take bisphosphonates while ensuring they receive adequate calcium and vitamin D through supplements or other food sources. Let's move to the next question. This prioritization in pediatric care question has been asked 7 times in the last 5 years, making it essential to review airway emergencies. A nurse in the emergency department is assessing multiple pediatric clients. Which of the following children should the nurse prioritize for immediate evaluation? A. Complains of frequent urination and burning sensation while urinating. B. Has a diagnosis of leukemia with small red or purple spots, petechiae, on the abdomen. C. Was diagnosed with acute epiglottitis 2 days ago and is now drooling excessively. D is experiencing ear pain with a fever of 101.1 degrees Fahrenheit, 38.4 degrees Celsius, and appears irritable and crying. The correct answer is C, diagnosed with acute epiglottitis 2 days ago and is now drooling excessively. C is correct. Drooling in a child recently diagnosed with acute epiglottitis is a critical sign indicating a potential airway obstruction. Acute epiglottitis is a severe, life-threatening infection of the epiglottis, which can quickly cause swelling and block the airway. Excessive drooling occurs because the child cannot swallow due to the swelling, which significantly increases the risk of complete airway obstruction. Immediate medical intervention is needed to secure the airway. The nurse should prepare for intubation or tracheostomy if the airway becomes compromised and expect the use of corticosteroids to reduce inflammation and antibiotics to treat the infection. A is incorrect. Frequent urination with painful urination is characteristic of a urinary tract infection, UTI, specifically cystitis, and while it needs treatment, it is not an emergency. Cystitis is common in children, and while uncomfortable, it is not immediately life-threatening. This child can be safely managed with a urine culture, antibiotics, and supportive care, and does not require immediate intervention compared to the risk of airway compromise in epiglottitis. B is incorrect. Petechiae are small red or purple spots that can appear on the skin due to bleeding under the skin and are commonly associated with thrombocytopenia in leukemia patients. While petechiae should be monitored, they are not an emergency in a child with known leukemia unless accompanied by signs of severe bleeding, bruising, or other symptoms of hemorrhage. This child requires ongoing care but does not need immediate follow-up compared to an airway emergency. D is incorrect. Otitis media, an infection of the middle ear, is frequently seen in pediatric populations, especially in children with upper respiratory infections. A mild fever and irritability are common symptoms. While the child may be uncomfortable and require treatment such as antibiotics or analgesics, this is not an urgent situation and does not pose the same level of danger as a compromised airway. The nurse should prioritize the child with potential airway obstruction first. Let's move on to the next question. This leadership style question has been asked 6 times in the last 5 years and is important for promoting team satisfaction. After reviewing feedback from the nursing team, the nurse manager realizes that staff members desire more involvement in decisions made on the unit and better communication with leadership. To address these concerns and improve overall team satisfaction, what leadership approach should the nurse manager adopt? A. Democratic. B. Transactional. C. Laissez-faire. The correct answer is A. Democratic. A is correct. A democratic leadership style is most effective when the goal is to increase staff participation and engagement. It encourages input from the team and promotes collaborative decision-making. This style helps create an environment where staff feel valued, as their opinions are considered in the decision-making process. Although it may take more time to reach a consensus, the increased participation can lead to greater satisfaction, commitment, and a stronger sense of ownership over outcomes. B is incorrect. Transactional leadership is based on a system of rewards and punishments, motivating staff through external incentives. While this style can be effective for achieving short-term goals and maintaining routine operations, it doesn't foster the open communication or shared decision-making that the staff is asking for. C is incorrect. Laissez-faire leadership allows team members to operate independently with little oversight or direction. While this can work in certain situations with highly experienced teams, it does not provide the engagement or structure that the staff in this scenario is requesting. This hands-off approach could lead to confusion and lack of cohesion within the team. D is incorrect. Authoritative leadership involves the leader making all significant decisions with little or no input from the team. This style can be effective in crisis situations, where quick decisions are necessary, but it does not align with the feedback provided by the staff, who are seeking more involvement and collaboration. Let's move to the next question. This medication education question about hydrochlorothiazide side effects has been asked 5 times in the last 5 years, making it a common exam question. A nurse is educating a patient who has been newly prescribed hydrochlorothiazide for hypertension management. Which of the following statements made by the patient shows a clear understanding of the potential side effects of the medication? A. I need to be careful with how much time I spend in the sun because hydrochlorothiazide can make my skin more sensitive to sunlight. B. This medication might make me feel sleepy or drowsy since it affects the brain like a sedative. C. Hydrochlorothiazide can cause a drop in my calcium levels, so I should eat more calcium-rich foods to compensate. D. I might experience a change in the way food tastes, or I could lose my appetite, which are common effects of this drug. The correct answer is A. I need to be careful with how much time I spend in the sun because hydrochlorothiazide can make my skin more sensitive to sunlight. A is correct. Hydrochlorothiazide belongs to the thiazide class of diuretics, which are widely used to treat high blood pressure and help remove excess fluid from the body. A lesser-known side effect of hydrochlorothiazide is increased sensitivity to ultraviolet light, or photosensitivity. This can lead to more severe sunburns if the patient is exposed to sunlight for extended periods. It is essential for the patient to understand that using sunblock, wearing protective clothing, and avoiding prolonged sun exposure can minimize this risk. This side effect highlights the importance of lifestyle adjustments while taking hydrochlorothiazide. B is incorrect. Thiazide diuretics, like hydrochlorothiazide, do not act on the central nervous system, so they do not cause sedation or drowsiness, which are effects more commonly seen with medications that have sedative properties, such as benzodiazepines or opioid painkillers. Patients taking hydrochlorothiazide are not at risk for impaired mental or physical alertness, so concerns about sedation are unfounded. C is incorrect. In fact, Thiazide diuretics tend to increase calcium levels in the blood, hypercalcemia, as they promote calcium reabsorption in the kidneys. This is the opposite of what the patient suggests in this statement. Rather than causing calcium deficiency, hydrochlorothiazide can be beneficial in preventing kidney stones in some patients due to its calcium-retaining effects. D is incorrect. While some medications can cause changes in taste or appetite, hydrochlorothiazide does not commonly produce these gastrointestinal or sensory side effects. Diuretics, like hydrochlorothiazide, primarily affect fluid balance and electrolyte levels, with symptoms related to low potassium, hypokalemia, being more common than changes in taste or appetite. Hold on. Before the next question, we've got thrilling news. Our NCLEX crash course is now available, and we challenge you to compare what we offer versus the competition. Classes are live daily for 1 hour over 3 months, starting from October 5th, and you'll have access for a whole year. Plus, you'll get 10,000 real questions and 50 practice tests to boost your preparation. Act fast. The 70% discount ends soon. Hit the link in the description to enroll now. Let's move on to the next question. This Erickson's psychosocial development question has been asked 6 times in the last 5 years, making it essential for exam preparation. A nurse is providing care for an infant who has been admitted to the hospital for dehydration and failure to thrive. Upon assessing the infant's history, it is noted that the mother has a long-standing substance abuse disorder. Given this background, the nurse is aware of the potential developmental challenges the infant may face. Based on Erickson's psychosocial development stages, which developmental outcome would this infant most likely be at risk for? A. Development of a sense of independence. B. Establishing a sense of trust. C. Development of mistrust. D. Experiencing feelings of shame and self-doubt. The correct answer is C. Development of mistrust. C is correct. According to Erik Erikson's theory of psychosocial development, infants are in the stage of trust versus mistrust. During this critical period, the formation of trust depends on the consistent meeting of the infant's basic needs, such as nourishment, comfort, and care. An infant whose needs are inconsistently met or neglected is likely to develop mistrust towards their caregivers and the world. In this case, the infant's hospitalization due to dehydration and failure to thrive, in conjunction with the mother's substance abuse issues, suggests that the infant's fundamental needs for care, stability, and attention may have been compromised. This environment increases the likelihood of the infant developing mistrust, as the child may not feel safe or secure in their interactions with primary caregivers. A is incorrect. Autonomy is a developmental milestone typically achieved during the toddler years, according to Erickson's stage of autonomy versus shame and doubt. During this phase, children start to assert independence and make decisions, such as choosing what to eat or attempting to dress themselves. This stage occurs after infancy and is therefore not applicable to an infant in this case. B is incorrect. Infants who receive consistent care and whose needs are met promptly will develop a sense of trust. Trust forms when infants feel secure in their environment, confident that caregivers will provide for them. Given the infant's condition and the mother's substance abuse history, it is unlikely that the infant's needs have been reliably met, making the development of trust less probable in this scenario. D is incorrect. Shame and doubt emerge during the autonomy versus shame and doubt stage, which occurs in toddlerhood, when children are exploring their independence. Failure to achieve autonomy can lead to feelings of shame and doubt, but this stage of development comes after the trust versus mistrust stage in infancy. Thus, shame and doubt are not relevant to the current situation with the infant. Let's proceed with the next question. This Wilms tumor question has been asked 7 times in the last 5 years, making it essential for pediatric oncology. A nurse is assessing a child diagnosed with a Wilms tumor. During the evaluation, which of the following clinical signs is most likely to be present? A. Increased heart rate. B. Slow breathing. C. Low blood pressure. D. Elevated blood pressure. The correct answer is D. Elevated blood pressure. D is correct. Wilms tumor, a malignancy that typically affects the kidneys in children, can lead to elevated blood pressure, hypertension, due to its effect on kidney function. The kidneys play a crucial role in blood pressure regulation, primarily through the renin-angiotensin-aldosterone system. The tumor's presence can disrupt this system by causing the release of excessive renin. This hormone leads to vasoconstriction and increased sodium and water retention, contributing to hypertension. Hypertension is one of the hallmark clinical signs in children with this type of renal tumor and should be carefully monitored as it can contribute to other cardiovascular complications if left untreated. A is incorrect. Tachycardia, or an abnormally fast heart rate, is not a typical finding in Wilms tumor. If present, it may be a sign of another underlying issue such as infection, pain, or anemia, and warrants further investigation. The normal heart rate in these patients should not be significantly elevated solely due to the tumor unless there are secondary complications such as anxiety or pain. B is incorrect. Bradypnea, or slowed breathing, is not commonly associated with Wilms tumor. This tumor primarily affects the kidneys, and respiratory rate is not typically influenced by its presence. If bradypnea is observed, it could indicate other medical problems, such as respiratory depression from medications or neurological involvement, which are unrelated to the direct effects of the tumor. C is incorrect. Hypotension, or low blood pressure, is not a symptom of Wilms tumor. In fact, the opposite, hypertension, is more commonly seen due to the impact on kidney function and the increased production of renin, which raises blood pressure. Low blood pressure in a patient with Wilms tumor could be a sign of other conditions, such as dehydration or hemorrhage, and should prompt further investigation. Let's move on to the next question. This omphalocele communication question has been asked 4 times in the last 5 years, making it relevant for understanding parental support. A mother is visibly distressed at the bedside of her newborn, who has just been diagnosed with an omphalocele. Tearfully, she exclaims, "I can't believe this happened. My baby won't survive this, will they?" Which response from the nurse would be the most appropriate? A. Please don't cry. It's not as bad as it seems. B. I understand this is overwhelming for you. While this is a serious condition, there are surgical options available that can successfully treat your baby's condition. We will provide the best care possible. C. Don't worry, your baby will be just fine. D. I know this is heartbreaking. Would you like to hold your baby now while you still can? The correct answer is B. I understand this is overwhelming for you. While this is a serious condition, there are surgical options available that can successfully treat your baby's condition. We will provide the best care possible. B is correct. This response combines empathy with informative reassurance, utilizing therapeutic communication techniques. It acknowledges the mother's emotional distress while offering her hope through accurate medical information. It helps the mother understand that although an omphalocele is a congenital condition where abdominal organs protrude outside the baby's body, surgical repair has a high success rate, with survival rates exceeding 90% in most cases. This response also promotes trust by assuring the mother that the healthcare team is highly capable and will provide excellent care for her infant. A is incorrect. Telling the mother to stop crying or diminishing her concerns is not supportive. This lacks empathy and can make the mother feel like her emotions are being dismissed or invalidated. In moments of crisis, it is crucial for healthcare professionals to acknowledge the emotional state of the patient or family and not minimize their feelings. C is incorrect. While providing reassurance is important, this response is overly simplistic and factually inaccurate. It gives the mother false reassurance by completely downplaying the risks associated with an omphalose seal. Even though the majority of cases are treated successfully, there is still a small risk of complications, and it is important to provide a balanced view. Omphalocele are associated with additional anomalies in some cases, so the outcome is not always guaranteed. D is incorrect. This statement, although sounding empathetic, wrongly implies an imminent death, which feeds into the mother's fears rather than correcting the misconception. Offering to let the mother hold the baby while insinuating it might be for the last time is inappropriate, as it does not align with the medical facts about the condition's generally positive prognosis with proper intervention. Let's move to the next question. This neonatal care question has been asked 6 times in the last 5 years and is highly likely to appear in the exam due to its frequent repetition. A nurse is caring for a newborn diagnosed with respiratory distress syndrome, a condition commonly seen in premature infants due to insufficient surfactant levels in the lungs. To address this deficiency and enhance lung function, which of the following medications would the nurse expect the healthcare provider to prescribe? A. Caffeine citrate. B. Poractin alpha. C. Dexamethasone. D. Levalbuterol. The correct answer is B. Poractin alpha. B is correct. Poractin alpha is an exogenous surfactant that is administered to neonates with respiratory distress syndrome. Respiratory distress syndrome results from insufficient natural surfactant in the premature infant's lungs, leading to alveolar collapse, impaired gas exchange, and respiratory failure. Surfactant lowers surface tension in the alveoli, helping them stay open during exhalation, which improves oxygenation and prevents lung collapse. Poractin alpha is given directly into the lungs via an endotracheal tube and is typically administered in multiple doses during the first 24 to 48 hours after birth, significantly improving respiratory status and reducing complications like pneumothorax and bronchopulmonary dysplasia. A is incorrect. Caffeine citrate is used to treat apnea of prematurity by stimulating the respiratory center in the brain. While it increases respiratory drive, it does not address the surfactant deficiency in respiratory distress syndrome and is not a substitute for surfactant therapy. C is incorrect. Dexamethasone is a corticosteroid administered to pregnant women at risk of preterm birth to enhance fetal lung maturation by promoting surfactant production in utero. After birth, surfactant replacement is the main treatment for respiratory distress syndrome, not dexamethasone. D is incorrect. Levalbuterol is a bronchodilator used for conditions like asthma or bronchospasm, not for surfactant deficiency. It relaxes the airways, but does not address the underlying problem in respiratory distress syndrome. Let's move on to the next question. This dietary management question has been asked 5 times in the last 5 years and is commonly tested in exams. A nurse is providing care to a patient diagnosed with diverticulosis who expresses concerns about not being able to consume sufficient dietary fiber to manage their condition. Based on this, what is the healthcare provider most likely to prescribe? A. Psyllium fiber supplement. B. Rectal oil retention enema. C. Codeine sulfate. D. Bisacodyl stimulant laxative. The correct answer is A, psyllium fiber supplement. A is correct. For patients with diverticulosis who struggle to get enough fiber from their diet, psyllium fiber supplements are recommended. Psyllium is a bulk-forming fiber that absorbs water into the stool, increasing its bulk and making it easier to pass. By softening stools and promoting regular bowel movements, it reduces pressure within the colon, lowering the risk of diverticulitis. Psyllium is considered a safe, long-term solution, but requires adequate water intake to prevent obstruction. B is incorrect. Oil retention enemas may provide temporary relief for constipation, but are not recommended for diverticulosis. Enemas increase pressure within the colon, which could lead to complications such as perforation, especially in patients with weakened colonic walls due to diverticula. C is incorrect. Codeine, an opioid analgesic, is unsuitable for diverticulosis as it can cause constipation by slowing gastrointestinal motility. This would increase stool retention and pressure in the colon, increasing the risk of diverticulitis. D is incorrect. Bisacodiol is a stimulant laxative that triggers intestinal contractions, which can cause abdominal cramping and increase pressure on diverticula, risking complications like perforation. It is not recommended for long-term use in patients with diverticulosis. Passing the NCLEX isn't for the faint-hearted. Only those who are serious about their future will stick with this video all the way through. Let's continue with the next question. This liver disease and pregnancy-related question has been asked 7 times in the last 5 years and is highly relevant for exam preparation. A nurse is assessing a pregnant patient who arrives at the emergency department with complaints of intense itching, primarily localized to the palms of the hands and soles of the feet. The patient has a known history of intrahepatic cholestasis of pregnancy. What associated clinical finding should the nurse expect in this patient due to cholestasis? A. Yellowing of the skin and eyes. B. Low blood pressure. C. Elevated blood sugar levels. D. Slowed heart rate. The correct answer is A. Yellowing of the skin and eyes. A is correct. Yellowing of the skin and sclera, jaundice, is a hallmark sign of cholestasis, especially in pregnancy. Intrahepatic cholestasis occurs when bile flow from the liver is disrupted, leading to a buildup of bilirubin in the blood. This causes jaundice, characterized by yellow discoloration of the skin and eyes. Cholestasis in pregnancy increases the risk of preterm labor and fetal distress, making this symptom critical for diagnosis and management. Treatment typically includes medications like ursodeoxycholic acid to improve bile flow. B is incorrect. Hypotension, low blood pressure, is not commonly associated with cholestasis. The main symptoms involve liver dysfunction, such as jaundice and itching, rather than cardiovascular issues. C is incorrect. Elevated blood sugar, hyperglycemia, is not linked to cholestasis. While gestational diabetes can cause hyperglycemia during pregnancy, it is unrelated to bile flow disruption in cholestasis. D is incorrect. Bradycardia, slowed heart rate, is not typically seen in cholestasis. The condition primarily affects liver function and bile metabolism, with no direct impact on heart rate. Let's move to the next question. This post-procedural care question has been asked 4 times in the last 5 years and is crucial for managing post-thoracentesis complications. A nurse is monitoring a patient who underwent a thoracentesis 2 hours ago to drain excess pleural fluid. Which of the following assessment findings would warrant immediate attention and further investigation? A. Repeated coughing episodes. B. Mild tenderness at the procedure site. C. Urine output of 200 milliliters within the last 2 hours. D. Small amount of blood-tinged drainage from the needle site. The correct answer is A. Repeated coughing episodes. A is correct. Repeated or persistent coughing following a thoracentesis may indicate a serious complication, like pneumothorax, collapsed lung. Thoracentesis involves inserting a needle into the pleural cavity to remove excess fluid. Although effective, the procedure can inadvertently puncture the lung, causing air to accumulate in the pleural space and leading to pneumothorax. Symptoms include persistent coughing, chest pain, and shortness of breath. Immediate assessment of the patient's respiratory status, including lung sounds and oxygen saturation, is necessary to identify this complication early and prevent further deterioration. B is incorrect. Mild tenderness at the thoracentesis site is an expected finding and typically resolves without intervention. It is not a cause for concern unless accompanied by severe pain, infection, or excessive bleeding. C is incorrect. Urine output of 200 milliliters in 2 hours is not related to the thoracentesis procedure. While fluid shifts may occur after draining pleural fluid, this amount of urine output is normal and does not warrant immediate attention. D is incorrect. A small amount of blood-tinged drainage from the needle site is common after thoracentesis. This is a normal post-operative finding unless there is excessive bleeding or signs of infection. Let's move on to the next question. This question related to congenital heart conditions has been asked 7 times in the last 5 years and is highly relevant for exam preparation due to its emotional and medical significance. A nurse is supporting parents who have just been informed that their newborn has been diagnosed with tetralogy of Fallot, a congenital heart condition. The parents, overwhelmed with grief, exclaim, "We can't believe our baby is going to die." How should the nurse respond to provide appropriate emotional support and accurate medical information? A. I'm deeply sorry you're feeling this way. How can I assist you during this difficult time? B. Don't worry. Your baby will be perfectly fine. There's no reason to be so concerned. C. While this condition is serious, tetralogy of Fallot is treatable through surgery. Let's discuss what this means for your baby's future care. D. At least you have this moment with your baby. Some parents don't get that opportunity. The correct answer is C. While this condition is serious, tetralogy of Fallot is treatable through surgery. Let's discuss what this means for your baby's future care. C is correct. This response strikes the necessary balance between empathy and providing important, accurate medical information. While acknowledging that tetralogy of Fallot is a serious congenital heart defect, it also offers reassurance that modern medical treatments, particularly surgery, can improve outcomes. It's important for the nurse to offer hope while helping the parents understand the condition. Surgery for tetralogy of Fallot can often correct the structural defects, significantly improving the prognosis for the baby. This response opens the door for further dialogue about the baby's care plan, thus helping alleviate fears through education. A is incorrect. Although this option shows empathy, it fails to provide essential medical information that the parents need to better understand the situation. The parents' main concern is the baby's potential death, and they need to know about the medical interventions available to treat tetralogy of Fallot. B is incorrect. Telling the parents everything will be fine can come across as dismissive of their fears. It provides false reassurance and minimizes the seriousness of the situation. Honest communication, combined with hope, is critical for supporting the family. D is incorrect. While it attempts to express comfort, this response is dismissive and could come across as insensitive. Parents facing a diagnosis like tetralogy of Fallot need reassurance about treatment options rather than being reminded of a perceived loss. Big news! Right before we dive into the next question, we're excited to announce our NCLEX crash course. Check the table to see how we outshine our competitors. Our new batch began on October 5th with daily live classes for 3 months, plus 1 year of access. You'll have 10,000 questions and 50 practice tests at your fingertips. But hurry, our 70% discount is about to end. Visit our website to enroll now. The link's in the description. Let's move on to the next question. This retirement-related emotional adjustment question has been asked 6 times in the last 5 years, making it a significant topic in mental health and aging. A nurse is providing care for a recently retired client who is struggling with the emotional adjustments associated with this major life change. Which intervention would best assist the client in navigating this new phase of life? A. Offering information about local organizations and social groups that cater to retirees. B. Suggesting the client focus only on reminiscing about their previous career accomplishments. C. Arranging visits from family members without taking the client's preferences into account. D. Recommending the client avoid discussing their retirement to prevent overwhelming feelings. The correct answer is A. Offering information about local organizations and social groups that cater to retirees. A is correct. Transitioning into retirement can be a challenging time, both emotionally and socially, as individuals may experience a loss of identity tied to their previous professional roles. By providing the client with information about local organizations and social groups tailored to retirees, the nurse is facilitating opportunities for social engagement, personal growth, and the development of new interests. These resources can help the client foster a sense of community, stay active, and adjust positively to their new role in society. Social interaction and new hobbies can mitigate feelings of isolation and promote emotional well-being. B is incorrect. While reflecting on past career achievements can be meaningful, encouraging the client to solely focus on the past may hinder their ability to move forward and find fulfillment in retirement. This approach could lead to feelings of nostalgia and regret, which may increase the risk of depression. A healthier approach is to balance reflection with the exploration of new opportunities that provide purpose and meaning beyond work. C is incorrect. Arranging family visits without considering the client's preferences undermines their autonomy and control over their personal life. It's crucial to respect the client's choices regarding their social interactions, as unwanted visits could cause stress or discomfort. Individualized care that respects the client's wishes is essential for promoting emotional well-being during this transition. D is incorrect. Avoiding discussions about retirement might lead the client to suppress their emotions, preventing them from processing the psychological and emotional aspects of this significant life change. Open and honest conversations about retirement allow the client to address any fears, anxieties, or aspirations they may have, which is crucial for emotional adjustment and successful coping. Let's move to the next question. This lightning strike emergency care question has been asked 8 times in the last 5 years, and prioritizing patients is critical for managing life-threatening injuries. Several individuals have been admitted to the emergency department after being struck by lightning during a powerful thunderstorm. Which of the following patients should the nurse attend to first? A. The patient who is unconscious and lying in a supine position. B. The patient who presents with paralysis in both lower limbs. C. The patient who appears disoriented, unable to recall personal information or the reason for their hospitalization. D. The patient who suffered a direct and significant electrical discharge across their body. The correct answer is D. The patient who suffered a direct and significant electrical discharge across their body. D is correct. the nurse must immediately prioritize the care of a patient who has sustained a large-scale electrical discharge from a lightning strike. Such an injury can lead to instantaneous cardiac arrest due to the direct impact on the heart and the nervous system. Electrical injuries from lightning can disrupt the heart's normal rhythm, causing irregular heartbeats or no heartbeat, asystole, which can be fatal if not promptly treated. The initial assessment should focus on the patient's airway, breathing, and circulation. Airway, breathing, circulation. Cardiopulmonary resuscitation, or advanced cardiac life support, should be initiated as indicated by the patient's condition. In cases of lightning strikes, rapid intervention, including using a device to restore heart rhythm, defibrillation, if necessary, is crucial for survival. Patients suffering from these injuries are also at risk for damage to the nervous system, breathing arrest, and secondary injuries from trauma. A is incorrect. An unresponsive patient in a supine position may also have serious injuries, but in the context of lightning strikes, immediate cardiac compromise due to a direct electrical injury takes priority. Unresponsiveness could indicate a variety of conditions, including moderate nervous system involvement or shock, but unless there are clear signs of compromised airway or cardiac arrest, the patient with the direct electrical injury presents a more immediate threat to life. B is incorrect. Paralysis of the lower extremities could indicate damage to the spinal cord or injury to the nerves outside the brain and spinal cord, which can occur following a lightning strike. While paralysis needs medical intervention, it typically represents a less urgent threat to life compared to the risk of cardiac arrest from a high-voltage electrical injury. Further assessments, including nervous system evaluations and imaging, would be necessary once the most critical patient is stabilized. C is incorrect. A confused patient who has memory loss after a lightning strike may be showing signs of a mild injury to the brain or shock, both of which are concerning but not immediately life-threatening. Disorientation or confusion is often seen with mild to moderate lightning injuries, but the absence of signs indicating immediate cardiac or respiratory compromise means that this patient can be triaged after those in more critical condition are stabilized. Let's move on to the next question. This Helicobacter pylori infection and peptic ulcer disease treatment question has been asked 6 times in the last 5 years, making it a commonly repeated question in exams. A nurse is managing the care of a patient diagnosed with a Helicobacter pylori infection, which is contributing to their peptic ulcer disease. The nurse anticipates that the healthcare provider will order which of the following medications as part of the treatment plan. A. Hyoscyamine. B. Ondansetron. C. Acyclovir. D. Clarithromycin. The correct answer is D. Clarithromycin. D is correct. Clarithromycin, an antibiotic, is one of the first-line treatments for Helicobacter pylori infections, typically prescribed as part of combination therapy that includes another antibiotic, such as amoxicillin or metronidazole, and a proton pump inhibitor, like omeprazole or pantoprazole. This approach is known as triple therapy and is essential to eradicate the bacteria responsible for inflammation of the stomach lining, gastritis, and peptic ulcer disease. The eradication of Helicobacter pylori is crucial to promote healing of the ulcer and prevent recurrence or complications such as cancer of the stomach. A is incorrect. Hyoscyamine is an anticholinergic used to relieve symptoms of gastrointestinal disorders like irritable bowel syndrome by reducing muscle spasms in the digestive tract, but it is not effective in treating bacterial infections such as Helicobacter pylori. B is incorrect. Ondansetron is a drug used to prevent nausea and vomiting, particularly in patients undergoing chemotherapy or surgery. It has no role in addressing the underlying bacterial cause of peptic ulcers. C is incorrect. Acyclovir is an antiviral agent used for managing infections caused by herpes viruses. Since Helicobacter pylori is a bacterial pathogen, antiviral medications like acyclovir are ineffective in this context. The appropriate treatment for Helicobacter pylori involves antibiotics and acid-reducing agents. Let's move to the next question. This metabolic rate question has been asked 6 times in the last 5 years, which indicates a strong chance of seeing it in your exam. A nurse is caring for a client who has experienced an unexplained increase in body weight over the past few months. The healthcare provider suspects a condition that may slow down the body's metabolic processes. Which of the following conditions is most likely to result in a reduced basal metabolic rate? Basal metabolic rate. A. Malignancy. B. Underactive thyroid, hypothyroidism. C. Chronic lung disease, chronic obstructive pulmonary disease. D. Heart failure. The correct answer is B. Underactive thyroid, hypothyroidism. B is correct. Hypothyroidism, characterized by insufficient production of thyroid hormones, leads to a significant reduction in basal metabolic rate, which is the energy expended by the body at rest to maintain basic physiological functions such as breathing, circulation, and cellular processes. Clients with hypothyroidism typically exhibit a slowed metabolic process, requiring fewer calories to maintain their daily bodily functions. As a result, they may experience weight gain despite a decrease in appetite. The thyroid gland regulates many aspects of metabolism, including the speed at which the body converts food into energy. Key clinical features of hypothyroidism include fatigue, slow heart rate, bradycardia, dry skin, cold intolerance, constipation, and abnormal lipid levels in the blood, dyslipidemia. In advanced cases, this can progress to myxedema coma, a life-threatening emergency characterized by severe metabolic and cardiovascular depression. A is incorrect. Malignancies or cancers usually lead to an elevated metabolic rate rather than a decreased one. Many cancer patients experience unintended weight loss due to increased metabolic demand, which can result from the body's heightened energy expenditure in response to cancerous cell growth. C is incorrect. Chronic obstructive pulmonary disease. Chronic obstructive pulmonary disease often increases the energy requirements of the body due to the additional work required for breathing, especially during advanced stages of the disease. This increased demand for energy can raise the metabolic rate, contrary to what occurs in conditions like hypothyroidism. D is incorrect. While heart failure may cause fatigue and reduced physical activity, it does not directly lower the basal metabolic rate. Instead, the body's energy needs are often maintained or can even increase due to the heart's reduced efficiency in pumping blood, leading to compensatory mechanisms that may slightly elevate energy use in certain cases. Let's move on to the next question. This ear medication administration question has been asked 4 times in the last 5 years and is vital for ensuring proper technique in pediatric care. The nurse is preparing to administer ear medication to a 6-year-old patient. Which of the following techniques should the nurse use to ensure proper delivery of the medication? A. Gently pull the earlobe downward and backward. B. Have the child lie on their side with the treated ear pressed against the pillow. C. Gently pull the upper part of the ear, pinna, upward and backward. D. Insert a cotton ball directly into the ear canal after the drops have been administered. The correct answer is C. Gently pull the upper part of the ear, pinna, upward and backward. C is correct. When giving ear, drops to a child who is older than 3 years, including a 6-year-old, it is important to position the child either lying down on their side or sitting upright with the affected ear facing upward. To ensure the ear canal is open enough for the medication to reach the eardrum, the nurse should pull the outer part of the ear, pinna, gently up and back, typically at about a 10 o'clock angle. This method helps to straighten the external ear canal, also known as the external auditory meatus, and ensures that the drops flow properly into the ear. A is incorrect. This method of pulling the earlobe down and back is used for infants and toddlers under 3 years of age, where the ear canal is more horizontal. For children older than 3, the ear canal is more vertical, requiring the upward and backward motion to straighten it effectively. B is incorrect. While it is necessary to position the child on their side with the ear to be treated facing up, pressing the ear against a pillow would prevent proper drainage and could interfere with the medication entering the ear canal. The correct position involves the treated ear facing up and not compressed. D is incorrect. Inserting a cotton ball directly into the ear canal is contraindicated. It is acceptable to loosely place cotton in the outer part of the ear after administering drops to help prevent leakage, but placing cotton directly into the ear canal risks causing an obstruction and may even push the medication out prematurely. Let's continue with the next question. This ICU shift report question has been asked 5 times in the last 5 years, making it crucial for safe patient handoff practices. A nurse in the ICU is giving a detailed handoff report to the incoming nurse regarding an elderly male patient. Which of the following information is most critical for ensuring the patient's safety during the shift change? A. The patient has clear breath sounds in both lungs and is breathing without difficulty. B. The patient shows signs of forgetfulness and has been attempting to get out of bed without asking for help. C. The patient has a functioning 20-gauge peripheral intravenous line that is saline-locked and patent. D. The patient has a tube inserted into the bladder, Foley catheter, with clear urine properly secured to the upper thigh. The correct answer is B. The patient shows signs of forgetfulness and has been attempting to get out of bed without asking for help. B is correct. The most important aspect to relay to the oncoming nurse is the patient's cognitive and neurological status, particularly because the patient is forgetful and is not calling for assistance when attempting to get out of bed. This behavior increases the risk of falls, which is a major concern in elderly patients, especially in the ICU. Falls can lead to significant injuries such as fractures, head trauma, or even death in older adults. Ensuring that the incoming nurse is aware of the patient's confusion and fall risk is crucial for implementing appropriate safety measures, such as using bed alarms, frequent rounding, or closer supervision. A is incorrect. While the patient's respiratory status is always important to monitor, clear lung fields and unlabored breathing are expected findings and do not present an immediate safety concern. The handoff report should emphasize abnormal or high-risk conditions over stable assessments, especially when it comes to risks like falls that could result in significant injury. C is incorrect. While ensuring the patency of an intravenous line is necessary, a functioning saline-locked peripheral intravenous line does not pose an immediate danger to the patient, unlike the risk of falls due to forgetfulness. D is incorrect. The patient's indwelling urinary catheter is patent and properly secured, but it does not carry the same urgency as the patient's cognitive impairment and fall risk. Let's move on to the next question. This fever-related question following vaccination has been asked 7 times in the last 5 years, making it highly relevant for pediatric patient care. A nurse is providing care for a 2-month-old infant presenting with a fever. The parents mention that the baby was administered the diphtheria, tetanus, and pertussis, diphtheria, tetanus, pertussis, vaccine 3 days ago. How should the nurse respond to the parents' concerns about the fever? A. Your baby should no longer receive this vaccine as the fever indicates an adverse reaction. B. This fever suggests a serious complication and immediate medical intervention is required. C. It is quite normal for infants to experience a mild fever following the diphtheria, tetanus, pertussis vaccine, as this is a common side effect. D. Mild fever is expected after this vaccine, but using ibuprofen for fever reduction isn't recommended at this age. The correct answer is C. It is quite normal for infants to experience a mild fever following the diphtheria, tetanus, pertussis vaccine, as this is a common side effect. C is correct. Following a diphtheria, tetanus, pertussis vaccination, mild fever is a frequently observed side effect and typically occurs within the first 24 to 48 hours after the injection. This mild immune response signifies that the body is responding appropriately to the vaccine and is not considered harmful. Parents should be reassured that this is an expected and typical reaction, especially in young infants. The fever is generally low grade and resolves on its own without the need for medical treatment. A is incorrect. Fever after vaccination is a common and non-threatening response. It does not indicate an allergy or adverse reaction that would contraindicate future doses of the vaccine. Discontinuing the vaccine series based solely on a mild fever would leave the child underprotected against diseases like diphtheria, tetanus, and pertussis. B is incorrect. Fever after the diphtheria. Tetanus pertussis vaccine is mild and anticipated, not a sign of a serious complication. Serious side effects from the diphtheria, tetanus, pertussis vaccine, such as a severe allergic reaction, anaphylaxis, are extremely rare. D is incorrect. While fever is expected, ibuprofen is not recommended for infants under 6 months. Instead, acetaminophen is a safer option for this age group if fever management is necessary. Let's continue with the next question. This post-cast care question has been asked 6 times in the last 5 years and is important for proper discharge education. The nurse is providing discharge instructions to the parents of a young child who has just had a plaster cast applied to their fractured arm. During the teaching session, the nurse is assessing the parents' understanding of proper care at home. Which of the following remarks made by the parents would warrant further clarification by the nurse? A. It seems normal for the cast to feel warm as it dries. B. If my child complains of constant itching, I could rub some lotion around the edges of the cast. C. We should keep the arm raised on a pillow to help minimize swelling. D. Using a blow dryer on a cool setting might help with any itching under the cast. The correct answer is B. If my child complains of constant itching, I could rub some lotion around the edges of the cast. B is correct. The nurse should provide further education regarding the risks associated with applying lotion or any moisturizing agents near or around the edges of the cast. Moisture trapped under the cast can create a warm, damp environment, ideal for the growth of bacteria and fungi, leading to skin infections or fungal growth. Instead, parents should be instructed to contact the healthcare provider if itching becomes unmanageable, rather than applying any substances directly to the skin near the cast. A is incorrect. It is entirely normal for a plaster cast to feel warm as it dries. This sensation should subside after the cast hardens completely, usually within the first 24 to 48 hours. The nurse does not need to follow up on this comment, as it accurately reflects expected findings. C is incorrect. Elevating the affected arm helps reduce swelling by promoting fluid drainage away from the injury site, especially in the initial 48 to 72 hours post-injury. Keeping the arm elevated on pillows can prevent excessive swelling and discomfort. D is incorrect. Using a blow dryer set to a cool air setting can help alleviate itching under the cast without causing harm. However, parents should avoid inserting objects into the cast to scratch the skin, as this can lead to abrasions or infections. Let's move on to the next question. This vancomycin-resistant enterococcus infection control question has been asked 5 times in the last 5 years and is critical for understanding delegation in infection control. A nurse is providing care for a patient diagnosed with a vancomycin-resistant enterococcus infection. Which task is appropriate for the nurse to assign to the unlicensed assistive personnel in this situation? A. Set up a gown and glove station just outside the patient's room entrance. B. Teach the patient and their family about effective strategies to prevent the spread of vancomycin-resistant enterococcus. C. Ensure that the correct sign indicating droplet precautions is placed on the patient's door. D. Assess the patient's ability to properly perform hand hygiene techniques. The correct answer is A. Set up a gown and glove station just outside the patient's room entrance. A is correct. A patient infected with vancomycin-resistant enterococcus must be placed on contact precautions, which require all healthcare workers and visitors to wear protective gowns and gloves before entering the room. Delegating the task of preparing the necessary personal protective equipment outside the room is appropriate for a unlicensed assistive personnel. Ensuring gowns and gloves are accessible helps to minimize the risk of cross-contamination and is part of standard infection control protocols. The unlicensed assistive personnel can be responsible for setting up this equipment as they support the nurse in implementing infection control procedures. B is incorrect. Educating the patient and their family about preventing the transmission of infections, such as vancomycin-resistant enterococcus, requires specialized knowledge and should only be conducted by a licensed nurse. This includes explaining hygiene practices, isolation protocols, and the importance of personal protective equipment. It is not within the unlicensed assistive personnel's scope of practice to provide patient education. C is incorrect. Although the unlicensed assistive personnel may assist in putting up signage outside the patient's room, the nurse must ensure that the correct type of isolation precautions is indicated. In this case, vancomycin-resistant enterococcus requires contact precautions, not droplet precautions. Incorrect signage could result in improper infection control measures, leading to potential exposure risks. D is incorrect. Evaluating a patient's understanding and technique when it comes to hand hygiene is a critical nursing function. It requires assessing the patient's knowledge and teaching proper technique, which involves clinical judgment and patient education beyond the unlicensed assistive personnel's scope of practice. Let's move to the next question. This jaundice assessment question has been asked 6 times in the last 5 years, making it likely to appear in exams. A nurse is evaluating an infant with darker skin for potential signs of jaundice. Which area would be the most accurate for the nurse to assess for the presence of jaundice in this infant? A. the hard palate inside the mouth. B, the sacral region and lower back. C, the area just below the knee on the lower legs. D, the nail beds of the hands or feet. The correct answer is A, the hard palate inside the mouth. A is correct. Jaundice occurs due to elevated bilirubin levels, leading to a yellowish discoloration of the skin and the whites of the eyes, sclera. In individuals with darker skin tones, the yellow tint may not be as easily observable on the skin surface. Therefore, it becomes essential to assess areas where pigmentation is less likely to obscure the yellowish discoloration. The hard palate inside the mouth, along with the sclera, is one of the most reliable places to evaluate for jaundice in dark-skinned infants. By examining the hard palate, the nurse can detect subtle changes in color that indicate elevated bilirubin levels. B, C, and D are incorrect. The sacral region, lower legs, and nail beds are less reliable for identifying jaundice in darker-skinned infants. These areas may not reflect the yellowing caused by bilirubin as accurately as the mucous membranes or sclera. The pigmentation of the skin in these regions can obscure subtle color changes, making them less ideal for jaundice assessment. Therefore, these areas are not recommended for assessing jaundice in infants with dark skin. Let's move on to the next question. This psychiatric care question has been asked 7 times in the last 5 years, making it a frequently repeated topic. A nurse is caring for a patient recently admitted to a psychiatric facility with a diagnosis of anorexia nervosa. Which intervention should the nurse prioritize in the initial care plan for this patient? Options. A. Allow the patient to choose their meals from the available menu. B. Request an order for the patient to begin therapeutic counseling sessions. C. Encourage the patient to decide their own mealtime schedule. D. Seek a prescription for a selective serotonin reuptake inhibitor, such as fluoxetine. The correct answer is B. Request an order for the patient to begin therapeutic counseling sessions. B is correct. Psychotherapy is considered one of the primary and most effective interventions for individuals suffering from eating disorders like anorexia nervosa. Cognitive behavioral therapy, CBT, is particularly effective because it focuses on identifying and altering the distorted thinking patterns that contribute to the patient's unhealthy behaviors, such as their fear of gaining weight and distorted body image. By addressing these underlying thoughts, psychotherapy helps the patient develop healthier attitudes toward food and self-worth. Establishing this therapy early in the care plan ensures that the patient receives the psychological support necessary for long-term recovery. A is incorrect. Allowing a newly diagnosed patient with anorexia nervosa to choose their meals immediately may not be beneficial. Initially, structured guidance in meal selection is necessary due to the patient's distorted views of food and calories. Over time, as the patient progresses, more autonomy can be provided. C is incorrect. Allowing the patient to decide their own mealtime schedule early in treatment would disrupt the therapeutic structure provided in an inpatient setting for patients with eating disorders, potentially leading to further avoidance of meals. D is incorrect. Although selective serotonin reuptake inhibitors like fluoxetine are sometimes prescribed for bulimia, they are not the first-line treatment for anorexia nervosa. Psychotherapy is prioritized before considering medication management in the treatment of anorexia. Let's continue with the next question. This disseminated intravascular coagulation-related question has been asked 8 times in the last 5 years, making it highly relevant for exams. A nurse recently participated in a continuing education session focused on disseminated intravascular coagulation. Which of the following clients would be most likely to develop disseminated intravascular coagulation based on their medical condition? A. A client with chronic iron deficiency anemia receiving intravenous iron supplementation. B. A patient being treated with antibiotics for a gram-negative bacterial infection. C. A client with atrial fibrillation who is on rivaroxaban therapy to prevent stroke. D. A client using aspirin daily as part of a regimen to lower the risk of cardiovascular disease. The correct answer is B. A patient being treated with antibiotics for a gram-negative bacterial infection. B is correct. Sepsis, particularly when caused by gram-negative bacteria, significantly increases the risk of disseminated intravascular coagulation. The endotoxins released by the bacteria during sepsis can trigger an overactive clotting response within the body. In disseminated intravascular coagulation, the excessive coagulation depletes clotting factors and platelets, leading to widespread hemorrhage and thrombus formation. Early diagnosis and management are crucial to prevent complications like hemorrhage and multiple organ failure. A is incorrect. Iron deficiency anemia, while serious, does not inherently predispose clients to disseminated intravascular coagulation. This condition affects red blood cell production, but does not trigger the coagulation abnormalities seen in disseminated intravascular coagulation. C is incorrect. While atrial fibrillation increases the risk of thromboembolic events like ischemic stroke, anticoagulants like rivaroxaban do not increase the risk of disseminated intravascular coagulation, which involves both excessive clotting and bleeding. D is incorrect. Aspirin, an antiplatelet agent, prevents clot formation rather than promoting excessive clotting as seen in disseminated intravascular coagulation. Let's move on to the next question. This neurogenic shock question has been asked 4 times in the last 5 years, making it a moderately frequent question in exams. A nurse is assessing a client who is suspected of being in neurogenic shock. Which of the following assessment findings would be most consistent with neurogenic shock? A. Distended neck veins. B. Slower than normal heart rate. C. Elevated body temperature. D. Slow, shallow breathing. The correct answer is B. Slower than normal heart rate. B is correct. Neurogenic shock is a form of distributive shock caused by a disruption in the autonomic pathways, often due to spinal cord injuries. It is characterized by significant vasodilation and bradycardia, slower than normal heart rate, due to the unopposed influence of the parasympathetic nervous system. This combination of hypotension and bradycardia distinguishes neurogenic shock from other types of shock. A is incorrect. Jugular vein distension is typically observed in conditions where there is increased central venous pressure, such as congestive heart failure, not in neurogenic shock. C is incorrect. Clients with neurogenic shock are more likely to experience hypothermia due to vasodilation and heat loss, rather than elevated body temperature. D is incorrect. Slow, shallow breathing is not a hallmark of neurogenic shock. Bradypnea might occur if the spinal cord injury affects the diaphragm, but tachypnea or normal respiratory rates are more common. This video is for students who are ready to give it their all. If you're truly serious about passing the NCLEX, don't stop watching until the final question. Let's continue with the next question. This prenatal care question has been asked 5 times in the last 5 years and is an important topic for exam preparation. A nurse at a prenatal clinic is evaluating a 25-year-old client who is 32 weeks pregnant. Upon reviewing the client's physical assessment and lab results, which of the following findings should be addressed with the highest priority? A. Presence of glucose in the urine. B. Client reports mild swelling in the feet at the end of the day. C. Client mentions an increase in vaginal discharge. D. Hemoglobin level of 14 grams per deciliter. The correct answer is A. Presence of glucose in the urine. A is correct. Glucose in the urine of a pregnant client, particularly in the third trimester, raises concerns for gestational diabetes mellitus. Gestational diabetes mellitus can lead to complications such as macrosomia, large baby, increased risk for cesarean section, and neonatal hypoglycemia. Prompt follow-up testing and interventions are necessary to manage glucose levels and prevent complications. B is incorrect. Mild swelling of the feet is common in the later stages of pregnancy due to increased pressure on the veins from the growing uterus. This finding, without other symptoms like high blood pressure, is not an immediate concern. C is incorrect. Increased vaginal discharge is a normal part of pregnancy due to hormonal changes and increased blood flow to the pelvic region. D is incorrect. A hemoglobin level of 14 grams per deciliter is within the normal range for a pregnant woman and does not indicate anemia or any need for intervention. Let's move to the next question. This eye assessment question has been asked 6 times in the last 5 years, making it a common topic for exams. During a routine health assessment, the nurse is checking a client's eye function. What is the appropriate technique to evaluate accommodation of the eyes? A. Shine a penlight from the side of the face toward the pupil and observe its response. B. Ask the client to focus on a far-off object, then shift focus to a closer object. C. Place a tuning fork on the client's forehead to assess vibrational perception. D. Position the client 20 feet from a Snellen chart and instruct them to read the letters. The correct answer is B. Ask the client to focus on a far-off object, then shift focus to a closer object. B is correct. To assess accommodation, the nurse should instruct the client to first fix their gaze on a distant object and then quickly focus on a nearby object. Normally, the eyes should adjust by converging, and the pupils should constrict when focusing on a near object. This tests the eye's ability to change focus between varying distances. A is incorrect. Shining a light into the pupil assesses the pupillary light reflex, which tests the eye's response to changes in light, but does not assess accommodation. C is incorrect. Using a tuning fork on the forehead is a technique used to assess auditory function, not eye accommodation. D is incorrect. The Snellen chart evaluates visual acuity, or the sharpness of vision at a distance, not the eye's ability to accommodate for different distances. Let's move on to the next question. This medication safety question has been asked 7 times in the last 5 years and is highly important for patient safety. A nurse is reviewing the medical history of a patient who has been newly prescribed naproxen for managing chronic joint pain. Which pre-existing condition in the client's history should prompt the nurse to discuss this medication with the healthcare provider before proceeding? A. Rheumatoid arthritis. B. Chronic heart failure. C. Osteoarthritis. D. Psoriatic arthritis. The correct answer is B. Chronic heart failure. B is correct. Naproxen, a non-steroidal anti-inflammatory drug, NSAID, poses significant risks for clients with a history of chronic heart failure. Non-steroidal anti-inflammatory drugs can lead to fluid retention, exacerbate heart failure, and cause increased systemic vascular resistance, leading to edema and worsening symptoms of chronic heart failure. The nurse should clarify the safety of this medication with the healthcare provider before administering it to a client with chronic heart failure. A, C, and D are incorrect. Clients with rheumatoid arthritis, osteoarthritis, or psoriatic arthritis may benefit from nonsteroidal anti-inflammatory drugs like naproxen for reducing inflammation and pain. However, naproxen is contraindicated in patients with chronic heart failure due to its potential to worsen fluid retention and heart failure symptoms. Only those who truly want to pass the NCLEX will stay until the end. Show you're serious about your future. Watch this video all the way through and don't quit now. Let's continue with the next question. This methicillin-resistant Staphylococcus aureus discharge instruction question has been asked 5 times in the last 5 years and is important for preventing infection at home. A client is being discharged from the hospital after treatment for a skin abscess that tested positive for methicillin-resistant Staphylococcus aureus. What is the most important instruction the nurse should give the client regarding infection prevention at home? A. Avoid using alcohol-based hand sanitizers and instead wash hands with soap and water. B. Use disposable plates and utensils for meals to prevent spreading the infection. C. Wear a face mask when in public to prevent airborne transmission. D. Ensure that the wound remains covered with a clean, dry bandage at all times. The correct answer is D. Ensure that the wound remains covered with a clean, dry bandage at all times. D is correct. Methicillin-resistant Staphylococcus aureus is primarily transmitted through direct contact with infected wounds or contaminated surfaces. To minimize the risk of spreading the infection to others, it is crucial for the client to keep the wound properly covered with a clean, dry dressing. The nurse should emphasize the importance of changing the bandage regularly and following appropriate hand hygiene after handling the wound. A is incorrect. Alcohol-based hand sanitizers are effective against methicillin-resistant Staphylococcus aureus and can be used when soap and water are not available. Hand washing is preferred when hands are visibly soiled. B is incorrect. There is no need to use disposable plates or utensils, as methicillin-resistant Staphylococcus aureus is not transmitted via the fecal-oral route. C is incorrect. Methicillin-resistant Staphylococcus aureus is not airborne, so wearing a face mask is unnecessary. The focus should be on preventing direct contact with the wound. If you're really serious about passing the NCLEX, you won't stop until you've finished this video. Stay determined and prove your commitment by sticking with it till the last question. Let's move to the next question. This postpartum hemorrhage management question has been asked 7 times in the last 5 years and is a high-priority topic for exams. A postpartum client is found to have a soft uterus and has soaked through 3 perineal pads within 3 hours after delivery. What should be the nurse's immediate intervention? A. Apply vaginal packing to control the bleeding. B. Perform uterine massage to promote contraction. C. Place an ice pack on the perineal area to reduce swelling. D. Prepare for administration of blood products. The correct answer is B. Perform uterine massage to promote contraction. B is correct. A boggy or soft uterus, also known as uterine atony, is a leading cause of postpartum hemorrhage. The nurse's first action should be to perform a fundal massage, which stimulates the uterine muscles to contract. This helps the uterus to regain tone and reduce excessive bleeding. Uterine massage is a critical, immediate intervention that can prevent further blood loss and stabilize the client. A is incorrect. Vaginal packing, which involves placing material inside the vaginal canal to control bleeding, is an invasive procedure and should only be performed by a healthcare provider in emergency situations. The nurse's initial action should focus on non-invasive measures, such as fundal massage. C is incorrect. Although ice packs can help reduce swelling and provide comfort, they do not address the underlying issue of uterine atony and excessive postpartum bleeding. The priority is to ensure the uterus contracts effectively. D is incorrect. Administering blood products may become necessary if the client's blood loss is severe and results in hemodynamic instability, but this is not the first-line intervention. The focus should be on stopping the bleeding through uterine massage before considering transfusions. Let's move on to the next question. This heparin infusion initiation question has been asked 5 times in the last 5 years and remains a key topic for clinical practice. A nurse has received a prescription to initiate a continuous infusion of heparin for a client diagnosed with acute coronary syndrome. What is the nurse's first priority before administering this weight-based medication? A. Draw blood to check the client's kidney function via a creatinine level. B. Accurately weigh the client. C. Measure the client's international normalized ratio. D. Ensure the client has a 20-gauge intravenous catheter inserted. The correct answer is B. Accurately weigh the client. B is correct. For heparin to be administered accurately, it is essential to calculate the dosage based on the client's precise weight. Using an estimated or outdated weight can result in incorrect dosing, potentially leading to either subtherapeutic effects or an increased risk of bleeding complications. Additionally, prior to starting the infusion, the nurse should also obtain baseline laboratory values, including an activated partial thromboplastin time and a platelet count, to monitor the effects of heparin during therapy. A is incorrect. While creatinine levels are important in assessing kidney function, this is primarily relevant for low molecular weight heparin like enoxaparin, which is excreted renally. Regular heparin is not significantly affected by kidney function, so creatinine levels do not influence the dosing. C is incorrect. The international normalized ratio is used to monitor warfarin therapy, not heparin. Heparin affects the clotting cascade differently, and its effects are typically monitored using activated partial thromboplastin time rather than international normalized ratio. D is incorrect. While it is important for the client to have appropriate venous access, the gauge of the intravenous catheter does not need to be as large as 20 gauge for a continuous heparin infusion. This is more relevant for procedures requiring rapid fluid infusion or blood transfusions. Let's move on to the next question. This diabetes education question has been asked 6 times in the last 5 years, making it a crucial topic for client education. A client with newly diagnosed type 1 diabetes mellitus is receiving education from the nurse. What is the most crucial concept for the nurse to teach the client regarding their new condition? A. Have hemoglobin A1C checked every 90 days. B. Regularly rotate sites for insulin injections. C. Perform daily foot examinations using a mirror. D. Identify early symptoms of hypoglycemia. The correct answer is D. Identify early symptoms of hypoglycemia. D is correct. Hypoglycemia, characterized by low blood glucose levels, can occur suddenly and is potentially life-threatening if not addressed immediately. Clients with type 1 diabetes must be able to recognize early signs such as shakiness, sweating, confusion, tachycardia, and irritability to treat hypoglycemia effectively with quick sources of glucose. Left untreated, hypoglycemia can progress to seizures, unconsciousness, or even death. Therefore, understanding the symptoms and how to respond is a critical part of diabetic self-management. A is incorrect. While monitoring hemoglobin A1C every 3 months is a key component of long-term diabetes management, it is less immediately urgent than recognizing and managing acute hypoglycemia, which can occur unexpectedly. B is incorrect. Rotating insulin injection sites is important to prevent lipodystrophy, a condition where fat tissue hardens, affecting insulin absorption. However, this is not as urgent as being able to manage hypoglycemia, which poses a more immediate risk to the client's health. C is incorrect. Regular foot inspections are necessary to prevent diabetic foot ulcers, which can lead to infections and amputation. However, these complications develop over time, making the recognition of hypoglycemia the higher immediate priority for a newly diagnosed diabetic client. Let's move on to the next question. This celiac disease management question has been asked 4 times in the last 5 years and is crucial for collaborative care. A pediatric client is suspected of having celiac disease, and the nurse is preparing a care plan. Which healthcare team members should the nurse collaborate with to provide the most beneficial support for the child's condition? A. Pharmacist. B. Pulmonologist. C. Occupational therapist. D. Dietitian. The correct answer is D. Dietitian. D is correct. Celiac disease is a chronic autoimmune disorder where gluten consumption triggers inflammation in the small intestine, leading to malabsorption. The role of the dietitian is critical in educating the client and family on a strict gluten-free diet, which is the only effective treatment. The dietitian will create a comprehensive dietary plan, guide the family in identifying gluten-containing foods, and ensure the child's nutritional needs are met despite dietary restrictions. Since gluten is present in many everyday foods, expert guidance is necessary to prevent accidental gluten ingestion and long-term complications such as growth delays and nutritional deficiencies. A is incorrect. A pharmacist might assist in ensuring that medications are gluten-free, but this role is not as central to managing the child's condition as the dietitian's role in dietary education and planning. B is incorrect. Celiac disease primarily affects the gastrointestinal system and does not typically involve the respiratory system. Therefore, consulting a pulmonologist would not be necessary. C is incorrect. Occupational therapy is typically used for clients needing help with daily living activities or rehabilitating from physical impairments. Celiac disease management focuses on dietary intervention, so the occupational therapist's involvement would not be critical in this case. Let's move on to the next question. This osteomyelitis diagnostic test question has been asked 5 times in the last 5 years and is important for infection diagnosis. A client presents with symptoms of a possible bone infection, and the nurse suspects osteomyelitis. What diagnostic test should the nurse anticipate being ordered to evaluate the client's condition? A. Erythrocyte sedimentation rate, ESR. B. Serum potassium. C. Serum creatinine. D. Prothrombin time, PT. The correct answer is A. Erythrocyte sedimentation rate, ESR. A is correct. Osteomyelitis, an infection of the bone, often presents with elevated inflammatory markers, such as the erythrocyte sedimentation rate, ESR. ESR is a nonspecific marker of inflammation, and an elevated result suggests an ongoing inflammatory process, like an infection. Although it does not provide definitive proof of osteomyelitis, it is useful in conjunction with other clinical findings to diagnose and monitor the condition's progression. B is incorrect. Potassium levels reflect electrolyte balance, which is unrelated to diagnosing bone infections. While electrolyte imbalances can affect muscle and cardiac function, they do not help diagnose or monitor osteomyelitis. C is incorrect. Serum creatinine measures kidney function and is not relevant to the diagnosis of osteomyelitis. Creatinine levels are primarily evaluated in conditions affecting renal function or in situations involving medications that impact kidney health. D is incorrect. Prothrombin time, PT, assesses blood clotting and is primarily used for clients on anticoagulant therapy or with suspected clotting disorders. It has no direct role in diagnosing or monitoring osteomyelitis. Let's move to the next question. This total parenteral nutrition, TPN monitoring question, has been asked 6 times in the last 5 years, making it an important topic for understanding TPN management. A client who has been receiving total parenteral nutrition, TPN, for the past 12 hours is under the nurse's care. Which of the following should be the nurse's priority when assessing this client? A. Measure urine output. B. Take an oral temperature. C. Assess daily weight. D. Check capillary blood glucose. The correct answer is D. Check capillary blood glucose. D is correct. Total parenteral nutrition, TPN, contains high concentrations of dextrose, which can significantly raise blood glucose levels, especially in clients who are not used to such an intake or have insulin resistance. Monitoring blood glucose closely is crucial to prevent hyperglycemia, which could result in complications such as diabetic ketoacidosis or hyperosmolar hyperglycemic state, HHS. Hyperglycemia can occur even in non-diabetic clients due to the concentrated glucose infusion, so regular monitoring is essential during the first few days of TPN therapy. A is incorrect. While monitoring urine output is important to assess kidney function and fluid balance, it is not as immediately critical as blood glucose monitoring in the context of TPN initiation, where hyperglycemia is a more pressing risk. B is incorrect. Although monitoring temperature is necessary to check for potential infections, which can be a complication of TPN, hyperglycemia from the dextrose-rich solution poses a more immediate danger to the client. C is incorrect. Weight is important for assessing fluid status and the effectiveness of nutritional support, but it does not need to be monitored as frequently as blood glucose levels when TPN is first started. Let's move to the next question. This question about managing hyperglycemic hyperosmolar state, HHS, has been asked 5 times in the last 5 years, making it a frequently repeated topic in exams. A nurse is planning care for a patient who has been diagnosed with a hyperglycemic hyperosmolar state, HHS. The nurse should expect to implement which orders from the primary healthcare provider? PHCP. A. Administer an infusion of 0.9% normal saline solution. B. Provide a dose of long-acting insulin glargine. C. Administer sodium polystyrene to manage electrolyte imbalances. D. Administer sodium bicarbonate to correct acidosis. The correct answer is A. Administer an infusion of 0.9% normal saline solution. A is correct. In hyperglycemic hyperosmolar state, HHS, patients with type 2 diabetes develop extremely high blood glucose levels, which lead to osmotic diuresis and severe dehydration. The first-line treatment focuses on restoring fluid balance, typically starting with isotonic saline, 0.9%, to rehydrate the patient. Rapid fluid replacement helps stabilize hemodynamics, and 1 liter of saline is often infused in the first hour with continuous reassessment of the patient's volume status. B is incorrect. While insulin therapy is required for hyperglycemia management,